I do now want to switch gears to the government shutdown. As you said, you're in DC right now. The government shut down after the clock struck midnight. I'm curious, walk me through a day in Congress, the first day of the government shutdown. What has your day looked like, and what have your conversations with your colleagues looked like?
So a lot of it has been about trying to figure out who will be impacted. And naturally, federal workers will be impacted, those on the ground, people who work at our airports, people who work at, different healthcare facilities, people who work at the Social Security Administration. Not everybody will be impacted, but things could slow down in different areas, VA facilities, that sort of thing. But ultimately, if this goes on much longer, there will be, things will slow even further, and there could definitely be areas where work will stop. But we also have to recognize, what are we standing up for and what are we trying to accomplish? We are really, as Democrats, we've been talking a lot about making sure that we restore healthcare to, the 16,000 Oregonians in my district who are going to be impacted by the draconian healthcare cuts that Republicans have implemented. So we want to make sure that we stop these cuts, lower costs, and save healthcare across America, but certainly in Oregon. So it's been a lot of making sure that we have the right strategies, the right messages, and making sure we get the message out to people back in our district.
What is the message from Democrats right now? Because I know that if you're missing a paycheck, federal workers won't be paid during this shutdown. 33% of Americans, according to a new poll from the New York Times and Siena College, say they blame both parties equally. They don't call this the Schumer shutdown. They're not calling this the Trump shutdown. They're blaming both parties. So what do you say to those people?
I say I can't worry about where the blame goes. What I need to worry about is making sure that people have what they need. And what people need right now is lower costs and affordable health care. And that is my goal. That is my goal with all of this. We are going to see healthcare costs increase by about $1,500 if Republicans refuse to come to the table. Sorry, $1,500 per month in additional premium costs. That is going to make premiums and healthcare unaffordable for somebody who is over the age of 60. That is unaffordable. We're talking about people who maybe have diabetes, people who have cancer, people who have children with, severe autism. These are people who otherwise would not be able to afford healthcare someplace else. What else are they supposed to do? These are people who maybe are also federal workers. So they're getting hit doubly hard. What I want to do is help to find solutions. And we have a solution. We can reverse what the Republicans have done in their dirty, big, ugly bill. We have a way to do this. We can stop their cuts, lower costs, and save healthcare.
Republicans have said